You feel like everyone around you has been getting sick with COVID. You're not imagining it. Former United States Surgeon General Jerome says right now we are in the middle of the most significant summer COVID surge in at least 2 years. Adams says that hundreds of people are still dying from COVID every week. And here in Virginia, COVID deaths last week, in fact, were up 10% from the previous week. Also on the rise, reports of long COVID.
We have millions of Americans now who are reporting long COVID symptoms. We know that long COVID is more likely to occur with repeated infections and with higher severity of infections. And it's one of the many reasons it's important for people to get their updated COVID-19 vaccine. It's been shown it can lower risk of long COVID by 70%.
Anyone who has been infected with COVID at any point is at risk of developing long COVID. The CDC says those symptoms can develop, go away, and redevelop repeatedly over weeks or even months. And when it comes to long COVID, vaccination is the best prevention tool. And speaking of those vaccines, with kids back in school and flu season right around the corner, now is a good time to plan your next appointment to get vaccinated. If you've avoided COVID infection this summer, the important thing to do is not wait. Adams says to get an updated vaccine as soon as possible. But if you've recently been sick with COVID, here's Adams explaining what you should do instead.
If you're someone who has been recently infected this summer, and many people have been, then the CDC recommends waiting 90 days to get your updated COVID-19 vaccine. That'll be around Thanksgiving, which is also a great time to get your flu shot. CDC says you can get COVID and flu vaccine at the same time. So
there you have it. Doctors say the best time to get your flu shot is by the end of October. Flu season peaks between December and February, and COVID tends to peak around the same time.